Congestive heart failure is a complex syndrome, and it refers to the inability of the heart to meet its demands of the body. That would be the most common or simplest description of congestive heart failure. We have 5.8 million patients with congestive heart failure, and the incidence is increasing. We are diagnosing 670,000 new cases a year. The death rate, however, is high from this disease, of up to 20% per year. It carries a high morbidity because, in my eyes, the heart is the center of the universe. So when the heart is not working, nothing else works very well. That's putting it lightly, but it is a serious condition and should be treated aggressively so that the patients feel better. You have two kinds of congestive heart failure. The most common kind of congestive heart failure occurs when the heart is inefficient, not because it is weak as a pump, but because it is very stiff. As you know from getting old, we all get more creaky and stiff in our joints, in our backs. So it's the same with the heart. It just becomes less pliable with age. So the muscles do not relax as well as they should, and therefore the heart does not fill with blood as efficiently as someone who is younger. High blood pressure and diabetes can cause the heart to get stiff more rapidly, and so do many other diseases. So this is what we call congestive heart failure in the setting of preserved ejection fraction, or when the heart remains strong in its pump function. The other cause of congestive heart failure is when the heart's pump starts to fail, when it gets weaker and weaker. That's when you say congestive heart failure in the presence of reduced ejection fraction. Ejection fraction refers to the percentage of blood that is pumped out of a filled ventricle during each heartbeat or each ejection. So the stronger the heart, the higher the ejection fraction. A normal ejection fraction at rest is about 55%, and it can rise to about 100% depending on how much you need. For example, if you are running away from a tiger, right? You are maximally stressed, and your ejection fraction, if you have a normal heart, will rise to 100%. You may not run away from the tiger, but your ejection fraction is at 100%. If you have a reduced ejection fraction, which is less than 55% at rest, when the tiger is coming after you, you may not be able to increase up to 100%, so your margin is less. A very damaged heart would have an ejection fraction of less than 30% at rest, and a moderately damaged heart has an ejection fraction between 30 to 40%, whereas a mildly damaged heart has an ejection fraction between 40 to 55%. The commonest symptoms of congestive heart failure that is easily recognizable would be swelling in the legs. Other symptoms would be the inability to breathe when you do something. Also, the inability to lay down flat in bed is a very specific sign for congestive heart failure. You could have a murmur. You could have poor circulation to your hands and feet, where they look blue and are cold. And if the heart is very weak, then the blood pressure could be very low, and the patient does not look very well.
What are the treatments for congestive heart failure?
In the acute setting, medications to clear the fluid is important to make the patient feel better. But those medications have no long-term benefit. There are a different range of medications that work specifically to improve the patient's quality of life over the long term, but also their longevity. But more importantly, they work to improve the patient's ejection fraction, and in a good number of cases, they can help normalize the patient's heart function. So those drugs have to be instituted and are considered mandatory in terms of quality measures in the treatment of congestive heart failure. It will never go away. You will always be diagnosed with congestive heart failure. The key here is whether we keep you tuned or not tuned. If you're well tuned, you can do a lot and lead a normal quality of life, and your longevity is increase as to somebody who's not well tuned. I do have a patient with an ejection fraction of 5%, but he is a scuba diving instructor and he's leading a normal life.